This announcement was made by the Minister of Health, Dr. Frank Anthony, on Thursday during his daily COVID-19 update. As Guyana joins the rest of the world in observance of World Sight Day 2021, it was conveyed that Guyana has a lot more work to do in the fight against eye diseases. To this end, substantial investments have been made to restore the National Ophthalmology Hospital located in Port Mourant, Berbice.
So work is ongoing. We are now in the process of restoring the microscopes that we have there, operating microscopes, and other forms of equipment. And we anticipate by the end of the year, a lot of these things would be in place.
Guyana's fight to eradicate the local prevalence of eye diseases such as cataract and glaucoma is not a new phenomenon. In fact, it was this need to eliminate these diseases that led to the establishment of the National Ophthalmology Hospital. The once state-of-the-art facility was commissioned in July 2009 as part of several projects under the Guyana-Cuba Collaboration Program initiated by former President Bar Jagdeo in 2006. At that time, it was expected that 10,000 eye surgeries would be conducted per year. However, after several years of being in operation, a fire in 2014, coupled with other challenges, resulted in the facility becoming dormant. Against this backdrop, the facility, which was reopened in February of this year, is expected to return to its former glory as Guyana's premier eye care facility.
We have invested substantial sums of money to be able to restore the equipment that we have there, and we're working actively to bring that back so that we can have full-fledged National Ophthalmology Hospital back again.
More recently, a diabetic eye care center was also functionalized at the hospital. A person who is diabetic can be diagnosed with diabetic retinopathy, which is caused by high blood sugar levels damaging the retina and can cause blindness if left undiagnosed and untreated.
During this week, we have been able to open one of these sites in Port Mourant, so persons who are affected by diabetes can come and get their eye checks to check to see whether their retina is also affected. This can help with the management of the patient and prevent blindness in diabetic patients.
It is expected that prevalence of eye diseases caused by refractive errors will be reduced by 30%, while diseases caused by cataract will be reduced by 40% before the end of 2030. This, the minister said, is a commitment made by the government of Guyana to the World Health Organization. Meanwhile, with regards to the country's COVID-19 situation, it was divulged that there are 3,798 active COVID-19 cases presently circulating in the country. While most of the active cases are in regions 4 and 3, there continues to be a steady rise in cases in regions 2, 7, and 10. Additionally, another call was made to business entities to enforce the COVID-19 guidelines. On Wednesday, it was revealed that some 52 businesses in Georgetown will be served warning letters for flouting the COVID-19 guidelines. Presently, 371,007 adults, or 72.3% of that population, have received the first dose of the COVID-19 vaccine, whilst 228,262 adults, or 44.5% of that population, have received both doses. The adolescents' vaccination numbers are also on the increase, with 26,130 adolescents receiving the first dose of the Pfizer shot, whilst 15,879 adolescents have received both shots. For the HTP Nightly News, Kendell Richmond.